Can we, Dr. Suparna and Dr. Catherine, can you just check your slides once? Share one slide and then check if it's working or not.
Did you want to go first?
Sanjana, can you just check the screen share option for them?
Yes, sir.
Just check if other speakers are also in attendees list instead of this, because some people would have used the other link that we sent. We hardly have another 5 minutes now.
Yes, sir.
Dr. Subbarao, I have given my PPT to Sanjana. She will share the slides for me.
Yeah, sure. She told me already. Sanjana, are you okay with the slides?
Can you see that? Does that look, is that in the presenter mode?
Yeah, one second. Yes, now it's good. Thank you.
Okay.
Right.
And I'll just go
Right.
through. So, yeah.
Yeah,
Okay.
it's working. Thank you very much.
Okay, thanks.
Sanjana, can you send me the background once again? I'm not able to, put it as my background because maybe a JPEG will do. Otherwise, forget it. Don't worry about it. I'm fine. Yeah, are we ready now? Just check if Dr. Bharti.
Yes, sir. I will send it.
We will just wait for another 5 minutes or so because it's just 10:25 in the morning, but we still have many more panelists to join. Meanwhile, Dr. Catherine, I think you know Dr. Sanjay Pandey and Dr. Suparna. Do you? Dr. Suparna is from the George Institute here. They're doing work in Chhattisgarh and in less reachable areas. So they're doing with schools. They're working with schools there. And Dr. Sanjay Pandey is with the Global Health Advocacy Incubator. They are one of our collaborators, and then also supporting the NULIFE initiative along with the Resolve to Save.
Hi,
And
Catherine.
then,
Hi, Dr. Suparna.
Nice to meet you both.
Dr. Sanjay, your camera is on or not? I don't know. I'm not sure.
No, because of the network frequency, so that's why I just kept it. I tried.
Okay.
Yeah. Because it's raining in Delhi today.
Yes, it's raining. I'm also here in Delhi.
Oh, yeah. For tomorrow meeting and yeah.
It's raining in Australia as well.
Okay. Hyderabad also, I believe, has lots of rain. Just my family told me that it's raining since morning. Ishani has to be promoted to panelist, no? Because she has to introduce.
Sir, I have sent you the virtual.
Yeah, I'll do that. Thank you. Just check if Dr. Bharati has joined. Madam has joined somewhere.
Good morning, sir.
I have joined.
Yes, madam. Yeah.
Good morning, ma'am.
Yeah, your background is flickering, madam. I think because of the light or the shadow of the fan.
No, fan is not running.
I don't know, but there's a lot of flicker around. I think it is better to remove the background.
Yeah. I remove. Um, I got it. No, how to remove because I have not clicked it on. Yeah.
Just my background, sir.
Yes, sir.
It's not a mirror image, no?
No, sir.
Okay, right. Thank you. Madam's is actually flickering. Yeah, now it is better, ma'am. I think.
Yeah, I have removed.
And just check other panelists. Dr. Suparna's is fine. Catherine's is good. Good morning, Khyati.
Hi.
Yeah, yeah. We'll just wait for another 3-4 minutes before we start. Uh, just check. Team, can you just check if all the speakers are in?
Yes.
All the speakers are adolescent. Rishita?
Yeah, I think
Yes, sir. Good morning, sir. Good morning, ma'am.
Hello, Rishita. Thank you for joining.
Hello, sir.
Yes, sir.
Thank
Thank
you
you.
so much, sir. It's definitely an
Rishita is
opportunity.
our adolescent nutrition ambassador from Let's Fix Our Food.
Yes, sir.
Vidhi ji, Miss Vidhi, she hasn't joined. Just check in attendees list once.
I can see her in attendance.
Sir, I just want to
Hello, sir. Good
confirm, am
morning.
I audible?
Good morning. You are audible.
Thank you, sir.
Right. Harish ji? Harish ji from NCRT? Shall I call him once? I think I'll call him. All the other panelists are here, right?
Yes, sir.
Take once. Yeah. I'll just call Harish ji, and then if he's here, then we'll start.
Morning, Dr. Zoya.
Morning, Dr. Bharti. How are you?
I'm fine, thank you.
Good. That's nice.
Hello, Dr. Zoya. Thank you for joining.
Yes, good to be here.
Could
Doctor-
you get the link and then could you share it with your colleagues?
Yeah, just share it with the state officials also. That
Thank you.
YouTube and the other one also. Yeah.
Thank you.
Sir, Dr. Jayashree also should join, sir.
Hi everyone, good morning.
Hello.
Good morning, ma'am.
Welcome, Harish ji. And then we just need to have
Jayashree
Good
ma'am.
morning, sir.
Jayashree ma'am, right?
Yes, sir.
Dr. Jayashree, okay. Do you have her phone number, Sanjana?
No, sir.
Okay, right.
Yes, sir. No, sir.
Yeah, I think Sanjana, Dr. Jayashree will join a bit later. She's, you know, traveling from hospital to somewhere, and then she said she'll join in 5-10 minutes.
Okay.
Okay. Is everyone ready? And the YouTube link ready?
Yes, sir.
Okay. The panelists and the director, ma'am, can we just go ahead?
Good morning, everyone. Hope I am audible.
Yes, yes, ma'am.
Okay.
Yes,
Yes,
Thank you.
ma'am.
Thank you, sir.
yes. Okay. Ma'am, can we start?
Yes, yes, sure.
Okay. Can we go live with YouTube? Ready? We live?
Yes, sir.
Right. Uh, did we open it for all the participants? All the attendees can now see?
Yes.
Okay, right. Good morning, everyone. And thank you all for joining this very important e-dialogue. It's part of the Let's Fix Our Food series, which we concluded last year. As an extension to that, with the collaboration from Resolve to Save Lives and Global Health Advocacy Incubator and UNICEF, we've initiated another series called Let's Fix Our Food New Life. New Life stands for nutrition, literacy, and improvement of food environments, especially for adolescents, abbreviated as NULIFE, New Life. So, as part of this Let's Fix Our Food New Life, today we are in our second of the webinar series. And today we are going to deal with a very, very important topic called creating healthy school food environments. Creating healthy school food environments has been a global priority now, in terms of research, in terms of policy, in terms of regulation. The background is pretty clear that the world is envisaging a quick rise in overweight and obesity, especially among adolescents and children. And adolescence and childhood is one of the phases of life where children pick up habits that might last through the life. And this being a very, very important phase where they also become autonomous, independent in terms of their food choices. This is the time for ensuring that they get into better and informed, healthy food choices. Considering that they spend most of the time in schools, uh, the school food environment becomes very, very important. In schools which serve meal, the responsibility lies to a large extent on the education system and the school managements to provide a balanced and healthy diets to them, an opportunity for physical activity, and also the food environment, the availability and the choice architecture of the schools and the school canteens is modifiable, and therefore a lot of onus lies on the schools and their managements. Nevertheless, in scenarios like that of India, we do have schools which do not have canteens, which do not have a midday meal provision, but still there are a lot of foods that are available around the schools in the vicinity, and this also actually comprises of the food environment to which the child is exposed. There is a court order from the Supreme Court of India to ensure that high fat, sugar, and salt foods are not sold to children in 50 meters radius of school. However, that regulation is still not in a very implementable stage because of clarity or lack of definition of HFSS foods. That being the scenario, the government is very conscious, and there are several initiatives that are being taken now. And with the Prime Minister's clarion call on reduction of fats and reduction of sugars, the NCRT, ICSC, and many school boards have started informing children about the sugar and sugar intake and why sugar intake needs to be limited by way of putting up sugar boards and fat boards in schools. And this is a very, very important behavioral nudge. While such efforts are still on, there are a lot of things that we need to do as a research fraternity to inform the policy for better regulation in the country. So this webinar actually is all about this. And then, as the structure of Let's Fix Our Food initiatives, we will actually learn about the global best practices first and set agenda for the rest of it, and then we will hear from our speakers drawn from different fields within the country as to what are the efforts that are on, and then we'll have a panel discussion wherein we get a well-rounded perspective from a multilateral agency, a practicing doctor, and then a panelist from education sector, and a teacher and a mother, and most importantly our youth and adolescent nutrition ambassador. This is the structure of today's webinar. Without taking much time, may I now request Dr. Bharti Kulkarni, our director, to say a few words. But before that, I'll request my colleague, Ms. Sanjana, to introduce our director briefly.
We are honored to welcome Dr. Bharti Kulkarni, Director of ICMR NIN India, a distinguished physician scientist in pediatrics and public health. Dr. Kulkarni brings over 2 decades of experience at ICMR NIN. Ma'am has previously served as a head of the Division of Reproductive and Child Health and Nutrition at ICMR, New Delhi. Ma'am academic journey spans a DCH from the University of Pune and MPH from Johns Hopkins University, and a PhD from Queensland University of Technology, Australia. Dr. Kulkarni has conceptualized and led large-scale multicentric research on maternal and child nutrition, anemia, body composition, diet diversity, and agriculture nutrition linkages. With over 120 peer-reviewed publications to her credit, ma'am has been the recipient of numerous prestigious research grants and awards and is an elected fellow of National Academy of Medical Sciences, India. We are delighted to have ma'am share her insights with her today. Thank you, ma'am.
Thank you for the kind introduction. Good morning, everyone. I'm very pleased to welcome you all on behalf of National Institute of Nutrition, which leads the Let's Fix Our Food Consortium. So on behalf of all our consortium partners, I'm very pleased to welcome you all for this important e-dialogue. We are all aware of the rising burden of obesity among our adults. We know that 1 in 4 adults are grappling with the problem of obesity, and the problem is rapidly rising in children and adolescents. As per Comprehensive National Nutrition Survey, which shows that about 5 to 6% children and adolescents are obese, and this is likely to increase exponentially further. As per the clarion call given by the Prime Minister of India, there is a need for all around efforts for battling this pandemic, which is becoming a serious concern for a country like India, which has a double burden of malnutrition. So it's extremely complicated for policies to simultaneously tackle both the spectrums of malnutrition, including undernutrition in underprivileged children, whereas rising obesity is another big challenge. So this and school age is very important because this is the foundation year, and this is the time when children's food habits become ingrained, and it depends on both the food environment as well as peer influence. So in today's e-dialogue, I think it's extremely important that we will discuss on what are the best practices, what are globally as well as what are the experiences of people working in India, and how do we make our school food environment healthy? How can we make healthy food aspirational among our youth? Because it is it is largely dependent on behaviors, and behaviors are very difficult to change. Knowledge does not translate directly to behaviors, and impactful behavior change communication, behavioral nudges, and making healthy food consumption aspirational among children is extremely important as we go ahead. So I'm very pleased to see that we have a very distinguished panel of experts as speakers as well as panelists, and I'm sure this is going to be a very enriching experience for all of you. Thank you so much for joining, and once again, I welcome you all on behalf of the National Institute of Nutrition and all the consortium partners. Over to you, Dr. Supriya.
Thank you, ma'am. Thank you for those, words of welcome. And then, uh, as per the schedule, I am supposed to give the opening remarks, which I already did. I don't want to take more time. Let's move to the next part of the agenda. But formally, let me welcome all the speakers and thank them once again for their time and interest in this topic. And then also, there are several attendees, and some of them are departments. And I thank all of them for joining and their interest. Hope they'll have a lot of information and a lot of knowledge to take home and then work on. Thank you very much. Now, may I request Sanjana to introduce Dr. Sanjay Pandey to give us an overview of LFOF New Life. Sanjana, over to you. Sanjana, it's okay. If you can't share the screen, it's fine. Just read out the. Do we have her online? Sorry for the technical glitch.
I don't think Sanjana is not online in the participant.
Okay. I would take the pleasure of introducing Dr. Sanjay Pandey. Dr. Sanjay Pandey has been a very important part of the Let's Fix Our Food initiative right from its initial stages, silently working on a lot of fronts and then helping us get to the right ministries and then right people in the ministries to spread our word. Uh, Now that the slide is open, you can see that Dr. Sanjay Pandey has over 20 years of experience and has a doctorate in economics from IIT Kanpur, and expertise is in strategic vision, leadership, and technical guidance, coupled with strong management oversight and project planning and program implementation. He has a great track record of developing new programs and driving state and national advisory initiatives to influence policy that we've seen while we've been working with him in the last 2 years. He has extensive experience in donor relationships and management. Dr. Sanjay Pandey is currently the lead consultant NCDs and economic advisor to GHAI, the Global Health Advocacy Incubator in India. Thank you, Dr. Sanjay Pandey, for joining. Over to you for your remarks.
Thank you so much, Dr. Subbarao, and for this introduction. So I'm really fortunate to really represent the Let's Fix Our Food Consortium, New Life, and happy to share with you, all of you, as uh, Dr. Kulkarni, Dr. Subbarao, and everybody, each one of you know, our Prime Minister is so concerned about the rising burden of obesity. And he gave a call that, okay, reduce the consumption of oil by 10%. And he also mentioned many times that India cannot be Viksit Bharat, a developed nation, unless and until we have a healthy people. And obesity, the burden of obesity cannot be the kind of leading us to the healthy nation. And you know very well, but I would like to again repeat the same number and data to highlight the real problem and the seriousness of today's discussion on that. Among the children, where the Dr. Subbarao has said that today's webinar is focused on the children. So the annual rate of increase in obesity among the boys has reached more than 12%, and among girls it is more than 8% or so. And if you see their daily life of the boys and girls, they spend less time, less than 60 minutes for the outdoor activities. So the physical activity is really has been reduced further on that. And also, if you see the fruits and eggs consumption and other things, that has also been reduced while the ultra processed food consumption have gone up. And you would have been noticed among your family members, family children, among the neighborhood and everywhere on that. And that's why today's discussion is so important. And also Niti Aayog and our think tank, they discussed about it. And in 2021, they identified 5 area of policy. And that's how in 2021-22, Let's Fix Our Food Consortium was initiated. Uh, it's a initiative of a collaboration among the like-minded people and organization who really want to help and contribute the policy direction, develop the policy to combat the childhood and adolescent obesity by discouraging consumption of the unhealthy foods in this. So in the past, we developed policy papers. 5 policy papers were developed in the first phase of that on the double duty taxation, taxation of the high fat, salt, and sugar foods, front of package labeling, nutrition literacy approach by adolescents, and regulating private and public media advertising on the HFSS foods. So these policy briefs were shared with the Niti Aayog also. And also we had conducted almost 5 webinars on these topics to take input from the professionals, general public, adolescents, and all stakeholders you can see in that way. And we also, it has got an advisory role, which has been shared with all the policymakers, with all the relevant ministries and everywhere, so that we support, we contribute to the fight against obesity and the unhealthy consumption on this. So the Let's Fix Our Food, New Life is also kind of aiming to have the healthy food habits among the children, among the adolescents, among the people in India, and with informed choices so that they are being informed with a proper definition of the high fat, salt, and sugar, as Dr. Subbarao also mentioned about that, so that we can tackle the negative influence and nudge at the multiple levels, at the community level, at the interpersonal level, at the individual level, by diligently focusing on the multiple aspect of this problem of behavioral, regulatory, marketing, and food environment. And the members of these consortiums are from the Niti Aayog, from even the FSSAI is also a member of this. We are approaching to the Ministry of Health and Family Welfare, Director General Health Services, so that they can also be a member of it. UNICEF, PHFI, Institute of Economic Growth, Global Health Advocacy Incubator, Resolve to Save Lives. So many development partners, many development agencies, they are all member of this. And the secretariat is housed in the National Institute of Nutrition, so that the thought leadership remains with the National Institute of Nutrition to contribute on that. I again help and request all of you to join the fight against the obesity. And we are really welcome all of you for this webinar, so that it really leads to that. So thank you so much, Dr. Subbarao, for this brief. Yeah.
Thank you, Dr. Pandey. Now we'll move into the webinar with Dr. Catherine Bacola, speaking about strengthening school food environments, global best practices, and the lessons learned. This, in a way, sets the tone for the rest of the deliberations of today's e-dialogue. May I request my colleague to please introduce Professor Catherine before she takes over.
I'm delighted to welcome Professor Catherine Backholer, Professor of Public Health Policy and Co-Director of the Global Center for Preventive Health and Nutrition at Deakin University. Her research focuses on addressing critical evidence gaps in food and nutrition policy advocacy, design, implementation, monitoring, and evaluation. Professor Catherine has a strong commitment to improving food environments to promote healthier diets, especially for children and adolescents. MAM works closely with governments and partners across Asia to generate policy relevant evidence and drive meaningful action on nutrition. Ma'am, we are honored to have you here with us today and look forward for your valuable insights.
Thank you very much for that introduction. I'll share my screen. Can you see that?
Not yet.
Okay.
Yeah, now we can see.
Okay, great. Thank you very much for that introduction. It's a real honor to be here, and I'm really excited to hear from all the presenters today and the panel discussion as well. So just a little bit of background on who I am. As mentioned, I co-direct the Global Center for Preventive Health and Nutrition, which is a center, there's about 100 of us at Deakin University in the south of Australia, working to essentially build the research that can catalyse improvements in population health with a major focus on nutrition. My work in particular focuses on improving adolescent nutrition by generating the necessary data required to inform government-led policies and programs. I have done quite a bit of work across South Asia, working with Dr. Subbarao and others. And most recently, this has culminated in a series within the BMJ tackling the triple burden of adolescents, girls, nutrition, focusing on a range of different issues. Most relevant to this webinar is looking at the home, school, and retail food environments driving obesity among adolescent girls in South Asia. So I want to start with posing a few questions, and that is, if we could design the perfect environment for children to grow, learn, and thrive, would it include easy access to food, jam-packed with salt, sugar, and fat at lunchtime? Would we invite junk food companies to market their products in the very places meant to protect children's health and well-being? I think everyone's here because they care about this issue, and I think everyone would say that we wouldn't design an environment like this for our children. Yet this is the very environment that we're seeing in almost all countries right across the world. And this means that children are developing unhealthy eating habits at the very same time that they're learning to read and write. So now imagine instead a school where every meal is nourishing and culturally familiar, where drinking water is plentiful, where every message about food promotes health, and where learning about nutrition is as normal as learning about maths or science. So in my talk today, what I'll do is share a little bit about why I think school food environments must be a top policy priority, and then highlight some examples around the world and the lessons that we've learnt from those policies around the world addressing school food environments. So why schools? Reiterating what Dr. Subbarayo said in his opening remarks, first, schools are one of the few places where we can reach children consistently every day over a decade of their lives. And when in places where there's high attendance rates, it makes them an ideal setting for intervention and a critical opportunity to reach all children, including those most at risk. Second, for children experiencing undernutrition, schools can support catch-up growth and cognitive development. And for all children, as Dr. Subbarayo mentioned, they can help establish lifelong healthy dietary patterns at a time when eating habits are still forming. Third, as children grow older, they have more autonomy over what they eat. And this makes the school food environment one of the most powerful influences of their food choices, and this is for better or worse. And fourth, improving the whole school food and nutrition environment from what's served in the, sorry, I'm not sure why my slides are going forward, including what's in the school canteen, what's marketed on the school fence, from water, the water available or the lessons taught, delivers benefits much beyond food. We know that it delivers benefits for health, so better diets mean reduced undernutrition, obesity, diet-related disease. Benefits for education, where well-nourished students are generally more alert, attend more regularly to school and perform better academically. And benefits for equity. So when health and food and nutrition education are accessible to everyone, we can start to close the gap between children from more disadvantaged backgrounds. So what does a healthy school food environment look like? This is a framework from the ASEAN Minimum Standards and Guidance document, which summarizes it quite well, I think, and shows the complexity of what a healthy food environment is. It identifies 5 interlinked action areas that together create a comprehensive approach to supporting good nutrition for school-aged children. And this is recognizing that interventions need to address food environments as well as those other factors relevant for broader nutrition, as Dr. Bharati said in her introduction. So nutritious foods and diets need to ensure all meals, snacks, and drinks meet energy and nutrient needs with limits on salt, sugar, and saturated fats. And this requires food safety standards, local procurement guidelines, safe preparation, storage, serving practices. The school food environment itself has to be healthy, so making the spaces in and around schools supportive of healthy eating. So this is affordable, nutritious foods that are available, no unhealthy food marketing, and that there's healthy options available and limited unhealthy options, that there's safe drinking water, proper sanitation, and training for canteen operators or caterers. It should also include ensuring there are sufficient school health and nutrition services, so providing the services required for undernutrition, but then alongside that, nutrition screening, overweight prevention, and referrals when needed. And then having good nutrition literacy programs by integrating food and nutrition education into the curriculum, using tools like school gardens, behavioural nudges to help children make healthy choices, training for teachers to deliver engaging evidence-based nutrition lessons. And then, of course, physical activity environments. We always think about food, but good nutrition includes good physical activity environments, ensuring children have regular opportunities for exercise through curriculum and access. And I think what's really useful about this diagram is that it demonstrates that these action areas have to sit within an enabling environment. So this is the role of governments, the role that sits outside of schools, where strong policies, accountability, Multi-sectoral collaboration and adequate resources make the implementation within schools possible. And this is really, really important. And then, of course, none of this works without monitoring, enforcement, and evaluation to ensure policies are actually being followed and having the intended impact. So just to summarize, a healthy school food environment and nutrition environment includes an integrated package of actions that all work together in an enabling environment to help children grow, learn, and thrive. I also want to make this point, and Dr. Sanjay also made this point in the opening remarks, and that is school food environments are powerful, but on their own, they're not enough to reverse the unhealthy weight trends we see in children. And there needs to be many other actions taking place right across the many different media and settings that children interact with. Overweight and obesity is driven by a complex mix of influences, from the foods available in the home to the advertising that children see on digital devices or TVs, or how their communities are designed. And so actions on school food environments must be embedded within a broader coordinated package of programs and policies. And that's what's really exciting about this Let's Fix Our Food initiative, that it does really comprehensively cover all the different initiatives that are needed to support adolescent nutrition. And then, of course, there needs to be also the systems enablers, so good governance, stable funding, workforce capacity, and monitoring and enforcement, which I mentioned before. So I'm just going to touch on a couple of examples of what's happening around the world, and I'll start here with Brazil. So this is Brazil has had one of the most comprehensive and long-standing school meals programs in the world. The aim of the program is to provide nutritious meals to millions of students, improving their health and educational outcomes while also supporting local agriculture. So this is really important. It's got a three-pronged aim of improving health, education, and local agriculture. It's also the cornerstone of Brazil's national effort to end hunger as part of the Zero Hunger strategy. So it acts as this safety net, ensuring children have at least one reliable, healthy meal each day while strengthening local food systems. It's got universal coverage, so every student in public basic education receives a free meal. There's nutritional standards, so meals are planned by nutritionists. They meet set energy and nutrient targets with limits on salt, sugar, and fat. Local procurement means at least 30% of ingredients come directly from family farms, prioritizing seasonal and cultural relevant foods. And food nutrition is integrated into the education, so the school integrated into the school curriculum to build those lifelong healthy habits that Dr. Subbarayo mentioned. And there's a focus on food safety, so strict hygiene, storage, and preparation standards. And then also embedded within accountability. So school feeding councils monitor implementation and compliance, which, as we know, is really important for implementation. Is it effective? The literature and the evidence would say it is. An analysis of national survey data has found a decline in household food insecurity among families with school-aged children in Brazil, and it's led to improved access to healthier foods through an increase in fruit and vegetable availability within the school setting. As I understand it, as Dr. Subbarayo mentioned, India also has one of the largest school meals programs in the world, which also reaches millions of children every day. And although the contexts are different between Brazil and India, it's interesting to see that both these school meal programs have a focus of not just improving nutrition, but also learning and education. And I'm excited to hopefully hear a little bit more about that today. The next country I'll speak to is Chile. So in 2016, Chile introduced their food labeling and advertising law, which included a comprehensive package of actions, including front of package label warnings, which you can see here with the hexagons to say they're high in salt, sugar, or fat. also a ban on child-directed marketing. So any marketing for unhealthy foods, those with these black hexagons, could not be targeted to children. So no packaging with cartoons, sponsorship, promotions aimed at children. But within this package was also some restrictions related to the school food environment. So that included that under the law, unhealthy products could not be sold within schools. They couldn't be offered as part of the school meals program or as free samples or gifts. And they also could not be marketed in schools or in any other media and settings, but in particular relation to schools, no unhealthy foods marketed within schools either. So this is one of the most comprehensive policies that I've seen. It's embedded into law, which is really important, and it's part of a comprehensive package with quite comprehensive measures within the school environment. There have been evaluations of the whole package of the law showing that students' intake of sugar, sodium, and saturated fat has fallen during school hours. So what you see here in this figure is the percentage point changes in daily calorie consumption for children from 2016, when the policy was first introduced, through to 3 years post-implementation. And you can see contributions to total daily energy intake for each setting changed over time. So we've got children on one side, adolescents on the other. And we saw the study found a decrease in the percent of energy from home and school. So if you look at the blue bars, you can see for children, the percentage energy from school was around 20 and it dropped to 16 over time. So that's great. There's been a reduction in the percentage energy calorie intake at school. But what has also happened at the same time is the proportion of energy from other settings has also increased in the yellow here. And so the key message here is that the policy interventions at the school level are promising to improve children's and adolescents' diets, but they need to be complemented by strategies that address the food environment in other settings where children spend their time. As Dr. Sibareo mentioned, the court order where India also has related to India's regulations around school food environments are very impressive as well, but with the ban on both the sale and advertising of high-fat, salt, sugar foods within 50 metres of the school gate. But as Dr. Sibareo said, that there are issues with implementation, and it'd be great to hear some more about that today as well. The last one I want to show you is an example from Australia, and this is not a really good case study. It's focused on the school food guidelines, so what can be sold in schools. So Australia does not have a single national food policy. Instead, each state and territory sets its own guidelines, and these guidelines are voluntary. They may be all underpinned by the Australian Dietary Guidelines, and most of them use a traffic light system to classify the food. So as you can see here, green foods are the healthiest options based on the core food groups. And the guidelines say that these should dominate the menu within schools, these green foods. You then have amber foods, so where there's some nutritional value to these foods, but they contain moderate amounts of sugar, salt, saturated fats, or energy. And the guidelines state that these kinds of foods should only take a small spot on the menu at schools. And then there's red food. So these are energy dense, nutrient poor items like fried foods, confectionery, sugary drinks. And the guidelines say that these are not recommended in school canteens. So on paper, this sounds really promising, but in reality, the picture is very different. In fact, a national audit of school canteens right across the country found that about 50% of schools meet the benchmark for green foods. Most of the menus are green foods, meaning that at least half the menu was healthy options. But nearly every single school in this national audit, 98.5% of them still sold at least one red item, despite the guideline that these should not be available at all. And often these were the cheapest and the most prominently placed within the school canteen. And so I think this gap between policy and practice shows why voluntary guidelines without strong monitoring and enforcement really struggles to deliver healthier school food environments. So I'll finish with the lessons learnt from many of these studies and right across the world. The first is that to ensure that actions within the school environment are comprehensive. So from what's on the menu to what's marketed in and around schools, to nutrition education and health services children receive, a healthy school should consistently model the food norms we want for our children. Second, we need to move beyond voluntary action. So relying on the goodwill or partial uptake of voluntary guidelines leads to patchy results, like you've seen in that example in Australia. I think the strength of the law with clear enforceable rules has much better chance of delivering consistent, lasting change, and we've seen that in Chile. Third, embedding strong monitoring and enforcement is critical. Even the best laws won't have impact without regular compliance checks, transparent reporting, and consequences for non-compliance. Fourth, we need to think beyond the school gate. So food sold and marketed in nearby shops, kiosks, or street-by-street vendors, or what children see on their digital devices can easily undermine what schools are trying to achieve. Extending healthy environments beyond the walls of the school is essential if we ultimately want to tackle nutrition for school-age children. Fifth, we need to leverage the win-wins, whereby many measures can support health, both undernutrition and overweight and obesity, but also environmental goals such as sourcing local, seasonal, and plant-rich foods. And then finally, we need to recognise that the school food is part of a bigger system. Unhealthy diets and childhood obesity are complex. It's a complex problem requiring system-wide solutions, and aligning school-based actions with broader work on agriculture, marketing, fiscal policies, and community initiatives is critical. So I will stop there. Thank you so much again for asking me to speak today. I'm really looking forward to the next hour and a half. Thank you.
Thank you, Dr. Catherine, for that very concise and clear presentation, and then the 5 lessons that we've learned from various experiments from around the world. Thank you very much. I know you have accepted at a very short notice and then prepared this presentation for us. Thank you again for that, and then thanks for your constant support as an individual and also from your university as part of the Let's Fix Our Food initiative. Now, understanding that Dr. Catherine has to leave a bit early before the webinar ends, we will quickly take a few questions that are there in the Q&A box for her. The first question, Dr. Catherine, is from Sonam Samat. The question is, what should be our success metrics? Is it children's health, knowledge metrics, healthy food consumption levels, or all the above, and how to do it?
I mean, I think it depends who you're talking to. So if you're talking to the Ministry of Education, educational outcomes are very important. If you're speaking to the Ministry of Health, health outcomes are very important. So I think we have to find ways to measure all these important outcomes, because it's what will sustain policies over time, because it's what gets the different sectors of the government interested and gets that political will for action to happen.
Okay, there's another interesting question. Are there any particular audit tools which are used to measure and monitor school food environments? I think you can throw light on the neatest tool, and I'll also request Ms. Samyukta, who's posted these questions, to stay back, because Khyati from UNICEF, Dr. Khyati, would speak on adopting the neatest tool in Indian scenario in Telangana state. Yeah, Dr. Catherine, on monitoring tools, please.
Yes, so the NEATS is the Nutrition Environment Assessment Tool, which was developed in the East Asia Pacific region. It's since been used and adapted in Sri Lanka, and I understand it's being adapted and used in India at the moment, which is again, looking at the school environment as a holistic environment for addressing nutrition. So not just food environments, but school meals, looking at food environments, so what's sold and marketed, looking at the curricula, looking at services as well. And it's a simple to use tool that takes a bird's eye view of what's happening in the school. It's been used by over 15 different countries across the world now, with many other countries that I know of that are using the tool. And it's really being used as an advocacy for action to say, look, across X number of schools that were audited, 80% of those sell sugary drinks, and X percent don't have good nutrition embedded within the school curricula. So it's a really powerful tool. It is online on the UNICEF website, the Nutrition Environment Assessment tool. And I know, as Dr. Subbarayo said, someone will be speaking to that later.
Yeah, and there's also a question to Dr. Sanjay and others in the panel about the 10% reduction on consumption of oil from Dr. Allappa. He says fat soluble, already India consumes, according to the existing data of 2014 NNMB, Indian children consume less of oil and fats. A further 10% reduction, would it compromise the fat soluble vitamins and other related health benefits? I think we can take this question. I can answer this question that the dietary guidelines for Indians suggest that fat should be sourced from different sources, including nuts and other things. But let's wait for the new data to come in. And a 10% reduction is very minor. It's not 10-gram reduction, it's a 10% reduction. It's a very minor reduction, and it's generally for those who are consuming more. If the children are consuming less, definitely it may not be applicable to them. We will, with that, I think in the interest of time, we will move to our next speakers. Now, may I request my colleague, Dr. Paramita, to introduce our next speaker, Dr. Vinuta.
Thank you, sir. I would now like to introduce our second speaker for today. She's Dr. Vinuta R.Y. She's the Nutrition Officer at PM Portion Department of School Education, Karnataka. She's a PhD in Food Science and Nutrition and has experience in the government sector, as well as experience in the academic research, experience in community work, product development and food quality analysis, laboratory experiments, as well as machinery handling. I would request ma'am to give her inputs on the current evidences and program implementation in India. Over to you, ma'am.
Hello, good morning, everyone. I'm Dr. Vinuta. I'm working as a nutrition officer in scheme in Karnataka Education Department. I would like to thank for giving me this speak in this webinar. Share the details of the activities we are carrying out in PM portion in Karnataka. Under the midday meals, we are providing the children of 1 to 5th standard, that is 450 kilocalories and 12 grams of protein, and upper primary, that is 700 kilocalories and 20 grams of protein. We are providing fortified rice, and we are providing wheat, we are providing tur dal, vegetables, sunflower oil, and salt, that is iodized. These are the quantities we are providing based on the standards, that is 1 to 5th standards. We provide 100 gram of rice and wheat 100 gram, tur dal 20, vegetables 50 gram, sunflower oil 5 ml, and salt 2 grams. And for 6 to
Dr. Vinuta, I'm sorry,
yes, sir?
can you just put it in slideshow mode, please?
Okay, sir.
Sorry.
Okay, sir. Now, okay. And for 6 to 10 students, we are providing 150 gram of rice, 150 gram of wheat, and tur dal 30 gram, vegetable 75 gram, and sunflower oil 7.5 ml, and salt 4 gram. This is for one child per day. And we are covering about 52,768 schools, that is government and aided schools. And we are covering 51,48,000 students from 1 to 10 standards, as well as Balavatika, that is LKG and UKG. This is the food menu we are providing in the under the midday meals. That is for 5 days a week we use rice and dal, and on Saturday we are providing wheat. And with that, we have a vegetable palav and rice dal rasam. When the day we give rasam, and we are providing vegetable sabji also. With that, we are also providing supplementary nutrition food to all the students of 1 to 10 students. That is, we are providing egg for 6 days a week. That is 2 days from the government, Karnataka government, and 4 days from Ajim Premji Foundation. And if the students who are not willing to eat egg, we are providing banana, that is 2 grams of two bananas per child per day. And we have a Kshira Bhagya Yojana, that is we provide 150 ml of milk that is made of 18 grams of whole milk powder plus 10 grams of sugar. It is given in the morning during the prayer time. And we are also providing Satya Sai the Sai Sure Ragi Health Mix from the Satya Sai Annapurna Trust. That is 5 gram Ragi Health Mix is given with which is mixed with the hot milk in the morning. We are also providing this for 5 days in a week to all the students. Some of the foods, rice we are using is fortified rice, which is provided by the HCI. And we are using fortified sunflower, which is fortified with vitamin A, D, and E. And we are also using iodized salt, which is procured from the local market. And we are also working with the health department, that is Rashtriya Bala Swasthya Karyakram. And they are also providing WIPS tablets, that is weekly iron and folic acid supplementation. For 1 to 5th, they provide 45 mg tablet once in a week, and 6 to 10th, that is 100 mg. And they are also providing albendazole, that is deworming tablet, yearly twice. And once in a year, RBSK team visits the schools, and they carry out the health checkup to all the students. And some of the best practices we are practicing under midday meals in Karnataka is we are also providing the food to 9 to 10th under 100% of state assistance. And to develop the more nutritional knowledge and more nutrition use of more nutrition food, we are developing school nutrition gardens in the schools by help of students. That is, and 37 schools, 37,000 schools have been SMG right now, and we are making it to reach the 100% goal. And cluster and taluk level training programs are being conducted for cook cum helpers, and we have 47,000 school kitchen centers and 60 NGOs who are providing 5,000 schools midday meals. So we are training the school cook cum helpers also regarding the safety, fire safety, deep cleaning, and personal health and hygiene to enhance the quality of the nutrition and the food provided to the students. And every September, we do the Poshan Abhiyan in the schools, where students are participating regarding and some debate competitions, essay competitions are all conducted for the students regarding the nutrition. And for Cook Come Helpers, we are also conducting the cooking competitions where they use locally available foods to prepare wholesome foods and easily preparable, and which are nutritious, more nutritious. And we have also Vishesha Bhojana initiatives where donors provide healthy, nutritious food and traditional food, locally available items to the schools on the occasions of the festivities, birthdays, and other special occasions. And we are working with some of the NGOs like Vision for Social Development. We are working regarding the reduction of salt in the day-to-day life. And we have conducted training programs for 2 divisions already in Bangalore and Dharwad division. They're also conducting the program in Mysore and Kalburgi divisions in Karnataka. And we already covered 117 ADPIs, 1,500 teachers, and 64,000 cook cum helpers regarding this reduction in salt in daily intake. These are some of the best practices where students and participation in Poshan Abhiyan. We are also circulated regarding the sugar and oil boards, provide sugar and oil board put up in schools, and they have also circulated regarding the 10% oil reduction. And we are also consulting doctors regarding benefits of eggs. And we have prepared some of the IEC materials. These are the IEC materials we use, and these are used in the schools regarding the salt also, and regarding the use of benefits of egg. And these are used in the morning session by the students, ambassadors in the schools. They say they use them, and they daily they are using these, and they are making students uh, know about the benefits of these foods, whatever we are providing. And these are the some of the best practices where fire extinguishing and cooking competitions, and students who have grown the nutrition foods from nutrition garden, these foods are used in the midday meals. So thank you. These are all the best practices we are practicing under PM Poshan, and we are also training the cook come help us once in a year regarding this. And we also have a YouTube channel, PM Poshan Karnataka, and we train them weekly based on these safety measures and good healthy cooking practices. These are some of the initiatives we have taken under midday meals. Thank you.
Thank you, Dr. Vinita, for that on ground kind of information that you've provided. We would also like to ask you if there are any specific measures to discourage children from consuming ultra processed foods that are available around schools. I think even in rural areas these days, you
Yes,
get
sir.
chips, you get biscuits, you get sugar sweetened beverages and things like that. Are there any specific training programs you incorporate, or is there any scope for incorporating such training programs to promote healthy food choices among adolescents?
Sir, now with the RBSK team and with the vision development, we are working on it, and we are educating the teachers now. So teachers are the close related to the students, and they spend most of the time with the students. So educating the teachers and the officials is more important right now. So as they visit the schools, and teachers are there in the school, teachers in turn educate the students, that will be more beneficial to educate them. And educating they also conduct, we have a mothers committee in the schools and SDMC committee. We are also a school development and monitoring committee. We are also training SDMC committee regarding the nutrition benefits. We are also involving them for development of the nutrition, school nutrition gardens in the schools. So we have given the instructions to all the school headmasters to involve SDMC as well as the mothers committee. They come, they daily one or the two to three parents come and eat the food prepared in the schools, and they give their opinion about the food. They daily document it in a Shuchi Ruchi Vahi, we call it in Kannada. So they are tasting records, what we call. So these are all the initiatives we have taken, sir. And we RBSK is also training the teachers regarding the health benefits of the nutritious foods we are providing, as well as the tablets they are providing, and how they can help the students to know better regarding their nutrition foods, sir.
Thank you. Thank you very much. Please stay with us. If there are
Yes.
any questions, we will take those questions at a later point of time. In the interest of time, let's move to the next speaker. We'll take questions at the end. And then may I request my colleague Sanjana to please introduce our next speaker.
I'm honored to welcome Dr. Suparna Ghosh-Jarad, Program Head for Nutrition and Food Policy at the George Institute for Public Health, India. With 29 years of experience spanning clinical, academic, and research nutrition, Dr. Suparna leads impactful projects on food system, dietary diversity, food security, and the prevention of non-communicable diseases. MAM heads major grants and trials, including the DBT Wellcome Trust India Alliance project on indigenous food system in tribal communities. NHR-funded food systems research with Imperial College London and the multi-center ICDS trial on improved take-home rations. MAM also holds distinguished academic roles on adjunct professor at the Manipal Academy of Higher Education and previously served as a professor and head of community nutrition at the Indian Institute of Public Health. Ma'am, we are privileged to have here with us today. Over to you, ma'am.
Thank you, Sanjana. Could you please share the slides?
Yes.
And I would like to thank um, the Let's Fix Our Food campaign people for inviting me to this session and share my experience, not as vast as what my previous speaker has shared, but more from a research perspective, developing a school-based intervention and creating an enabling school environment in rural India. So once Sanjana shares the screen, I'll start my presentation. Sanjana, should I ask Ayushi to share? Ayushi, will you be able to share the screen, please?
Sure, ma'am.
Yeah. It's okay, Sanjana, Ayushi will share. Thank you.
Yes.
So this was the topic, evidence to action for India, current policies and programs in India to ensure a healthier food environment in schools. So both my preceding speakers have really set the stage very well, where Catherine has presented the global perspective and my previous speaker has spoken about the initiative in Karnataka, where more than 1 million children are being benefited from the school feeding program, which is called the PM Poshan, that is Pradhan Mantri's Poshan Shakti Nirman program. We tried to experiment with this program in the rural communities of Chhattisgarh. Next slide, please. Just to give you a brief about the framework where we are working. So we know that the food systems, that is the food supply chain, the food environment, and the individual factors, and finally the consumer behavior, which translates into nutritional status, is affected by multiple drivers. And those drivers are very well explained in terms of governance drivers, policy drivers, enabling food environment is what translates into food choices. So creating an enabling environment in school is a very important way of kind of facilitating a situation wherein children can make informed choices. And since they are in their formative years, spending more than 6 hours a day in schools, the school food environment can have a long-term implication in addressing their nutritional status and may have an impact on the nutritional status of the households from which they belong. So, the PM Poshan program can be considered as one of the important policies and programs which can have a long-term implication on what these children will eat in future, as they are, PM Poshan program itself is a part of the built food environment or a formal food environment wherein a government food procurement program is providing diets to children, which is meeting 1/3, like the Karnataka presentation has shown, that it is 1/3 of the day's requirement for most of the children in the primary and the upper primary schools. Next slide. So with this background, we tried to remodel the PM Poshan program implementation in rural areas of Chhattisgarh, thereby promoting dietary diversity, but also with a planetary health lens. That is, we wanted to make this program environment friendly as well. Why? Because this is the rural community which is also producing food for the rest of India. And when the children are consuming diets in school in that environment, can we also make that particular program planet friendly? So school food program, food environment, wherein we try to integrate school meals along with nutrition education, because only meals may not serve the purpose. The nutrition education is critical, and all these being provided within the continuum of sustainable school food experience. We wanted to develop a sustainable school food system that not only benefits children's health, but also the planetary health. And the intervention comprised of community managed Nutri Gardens, promoting smaller supply chains or reducing the food miles, cooking and promoting sustainable school food menus along with nutrition education. The value addition of this entire intervention is to enhance acceptability and meal uptake, thereby contributing to sustainable food practices in schools, and also, if there is a plate waste that is happening, reducing that as well. So this was the premise in which this study was conceptualized. This was a part of an NIH, our National Institute of Healthcare and Research grant to establish a global health research center for non-communicable diseases and environmental change in India, and in partnership with two other low middle income countries. And in India, our focus was food systems intervention because it comes intermediary between health and the environment. So we aimed to develop, co-develop, implement, and evaluate a diversified government institutional feeding program for children utilizing community-based Nutri-Gardens complemented with Nutri-Education to improve the diet diversity among rural children of Chhattisgarh with environmental co-benefits. The targeted programs were all the three public food procurement programs like the PM Poshan, the supplementary nutrition program provided in ICDS, and the PDS. However, in this presentation, I'm focusing on the PM Poshan work that we have done in the Sarguja district of Chhattisgarh. Next slide. And the work is still continuing. The study area comprised of 4 blocks of Sarguja district, and we adopted a research design wherein we are doing a quasi-experimental trial to see whether this diversified school-based program is bringing about any change in the dietary diversity of children as well as their families. Next slide. So the study phase is comprised of a formative phase where to co-develop something, we must understand the ground reality and contextualize our intervention based on the need from the community. So there was a formative phase, there was a co-production phase, and now the ongoing phase in the implementation part. Next slide. In the formative phase, we adopted a mixed methods design. Previous slide, please. We adopted a mixed methods design wherein we interacted with the key stakeholders in the community, including the school program implementers, the officials at the higher levels, the community, and used surveys to understand the current dietary diversity in the diets of children and their parents, and also what is happening at the program level. Next slide. We found innovations happening in the state of Chhattisgarh, especially amongst the rural schools, wherein we found that according to the menu, there were prescriptions, but in reality, perhaps that diversification was not happening to that extent. And there were motivations at the lower level where the district collector was talking about giving milk to children as a good source of protein, or giving good quality pulses to the children, utilizing some kind of a corporate social responsibility funds. Next slide. We also kind of looked at the supply chain of and using the network tool, which is developed by IFPRI, we tried to look at the entire supply chain of the midday meal program to look at wherein the localization can happen, and also what is the power dynamics, who is responsible for what decision, to what extent can decisions be taken at the grassroots level to diversify the food and make it much more local and contextual. By this supply chain mapping and stakeholder mapping, we understood where are the key potentials of intervening into this particular program to make it much more local, diverse, as well as environment friendly. Next slide. So the perception of the key stakeholders showed that the menu can be further diversified. Addition of millets were suggested, addition of milk, eggs, fruits were suggested by the stakeholders as well as the community. Nutri-Garden was something they had tried, but they were not successful because ownership was a big issue if they wanted a Nutri-Garden to be adjacent to the school. What will happen during the vacations? Who will look after? Who will take the ownership? Teachers are already burdened with so much of work. Asking them to have Nutri-Gardens engaging children could be a challenge for them. Skill was a big issue. The cooks had to be told. We sort of assume that culinary skills are natural. Well, perhaps we need to use a little bit of modern science and contextualize the local knowledge and make a dish a particular recipe really nutritious, nutritious in the real sense, make it safe for consumption. And also the infrastructure which exists, the cooking facilities, what they are using, the kind of fuel they are using, or the cost. The cost was a major issue to finally diversify these meals, and therefore discussions reducing the cost of certain things by localizing or reducing the supply chain. Next slide. So we went through a co-development phase. So whatever we understood, we then developed interventions in terms of using nutrition literacy pathway, using food production pathway, using a nutri-garden model, and also capacity building pathway, wherein nutrition education, to provide nutrition education to the children in the community, the frontline workers had to be told about how to be good communicators, counselors, because we cannot assume that just making IEC material will help. We need to actually understand the communication skills of these workers and utilize these IEC material as their weapons to communicate better. Next slide. So, some interesting participatory activities for improving understanding of what children want. So we showed them what we are giving them now, and we asked them which day's menu really makes you, look forward to consuming that day's menu. And they told, and we asked them, what do you want in your plate? So they had all those examples, and unfortunately, some of them are in the rural surroundings also are aware of those packaged, highly marketed, highly advertised food commodities. But luckily, they spoke about all the fresh fruits and vegetables because we had those cutouts in front of them. So healthier choices were reinforced while we were doing this participatory activity. Next slide. So the finalized intervention was community managed Nutri Gardens that I have already said, but we had to enhance the competency of the smallholder farmers and the households from where these children were going to school. We wanted a complete participation, community participation and community ownership to roll out this intervention package. The second was menu diversification, where we diversified the menu, utilizing the local foods, capacity building of the implementers in cooking those menus, and then capacity building in nutrition education. Ayushi, you can quickly now keep changing the slides because it's taking time at your end. Community engagement was at the heart of all these interventions, wherein we wanted to really co-develop. So the first component to develop these kitchen gardens, we went to the community, identified the farmers, and we sort of spoke to them about what we are planning to do and whether they kind of signed an agreement also, an informal agreement with us. Next slide. And now please keep moving the slides because there is a time lag. So we had orientation sessions with the farmers. Next slide. Then we created these Nutri Gardens in partnership with them as well as local NGOs because we wanted it to be sustainable. Local NGOs are trusted upon by the government to partner in these initiatives. Next slide. So we had crop cycles developed. We had, next slide, please. We had crop cycles developed. We had on-the-field training. Next slide, trailees preparations, and all those activities happened. Seed kits were developed with indigenous seeds in discussion with the KVKs and the Krishi Vigyan Kendras and the NGO.
Dr. Suparna, you here? Dr. Suparna?
I think her internet is
Yeah,
not.
you can go on, please. Yeah.
Yeah.
Next.
So these are the food items that were produced in the Nutri Gardens, and these all will be supplied to the schools. And we focused on indigenous
And
varieties.
nursery preparations happened. Next slide.
Keep moving. Yeah.
Yeah, she's back.
I think there is still an issue with her connectivity.
Yeah, I have joined back. Yeah,
Yeah,
I've joined back. Yeah, sorry for that. I'm sitting in a remote part of India, so
Understand. Yeah. Next slide, please.
Yeah, so the next slide is that we sort of the whatever the produce was then shifted to the plan is to shift all these food products or develop a supply chain to the Anganwadi centers and the schools. And the activities under the component 2, 3, 4 is capacity building. Capacity building in the sense like we wanted to utilize the IEC material which are already developed by NIN, by the Eat Right campaign, and we wanted to use those material while contextualizing it to the rural scenario. Next slide. So if you see, these are the materials which are adapted. So some of the material, the concept is same, but we know that the cooks and the people who are serving in the kitchens are semi-literate. So they cannot use recipe books. What to do? We made pictorial demonstration of the recipes, and we want to put it in prominent places in the school for them to see how much of food needs to be cooked for 10, 20, 30 people. And then we can quickly develop the recipes and give it to children. And lots of training material and handouts and material for providing the kitchen gardens and all also were developed. Next slide, and I'm done with my presentation. The last slide is on more material on school-based education. But if you see, the foods need to be contextualized to rural community. It cannot have pizzas and burgers on it, but maybe samosas and local colored foods, which are ultra-processed foods, which are being sold in the rural communities. So this is how we have developed a portion education kit. Now the intervention will be rolled out, and we are going to see whether it is going to bring about dietary diversification in the diets of the children. Thank you.
Thank you, Dr. Suparna. I hope you'll stay back with us for a while to take the questions at the end of the next presentation as well. There are some questions, interesting ones to take, but we will have Dr. Zoya's presentation first and take all questions at a time before the panel discussion. I hope that works with you. Okay. May I request Dr. Paramita to please introduce our next speaker, Dr. Zoya Ali Rizvi.
Yes, so I'm Dr. Zoya Ali Rizvi. She is the Deputy Commissioner at Nutrition and Adolescent Health at Ministry of Health and Family Welfare, Government of India. Dr. Rizvi brings over 2 decades of experience in policy formulation, program implementation, multi-sectorial collaboration at improving health outcomes across India. She holds an MBBS from King's George Medical College, Lucknow. She has 6 gold medals, 12 certificates to her excellence, and she has also done her MSc in public health public health in from University of London. She is a public health leader leading key national health initiatives like the Rashtriya Kishore Swasthya Karyakram Ayushman Bharat, management of SAM children IYCF interventions, and so on. Ma'am, I would like to request you to share your inputs. Over to you, ma'am.
Yeah, thank you. Thanks for those kind words. So thank you. Is my screen visible?
Yes, ma'am.
Okay, now also it is visible.
Yes.
Yeah, can you please put it in the slideshow mode, ma'am?
Yeah, I have done it. Hopefully it will come slowly on slideshow. So yeah, good afternoon, everybody. And I will try and keep my presentation short and from a very government's perspective. So it's going to be quite different from a research background. Just to say is that for a country like India, why is healthy school environment so important? First, of course, we do realize that early childhood nutrition is really very essential for optimal growth, both mental as well as physical. Second, children spend a substantial amount of time, about 7 to 8 hours in school, which makes schools a hub for shaping the eating habits and also providing unique opportunity for implementing any targeted nutrition intervention in schools. Third, we also realize that under and over nutrition, both of them have physical, emotional, as well as psychological effects. So we have to address that issue also. We can address it through schools. Fourth, the research has indicated that food available within and around school, it significantly impacts both the short-term as well as long-term nutrition trajectories. So for us, is one side availability of unhealthy food options may contribute to development of poor dietary patterns, limiting acceptance of nutrient-dense food. And on the other side, also readily available, affordable, appealing, healthy food options will encourage children to choose nutrition meals, leading to better health and well-being. So this is the background as to why it is important for us to look at school as a very important intervention platform. Just building background, because for us, undernutrition and overnutrition both are a part of malnutrition. This you're fully aware, but just I'm saying that undernutrition also per se accounts for 68% of deaths in under 5. It reduces physical growth, mental development, functional, which I mentioned in the previous slide, and also in the long run damages the economic productivity of individuals and societies as a whole. So what we're looking at, if you treat undernutrition, malnutrition, it is much more as the preventing of both of them, under and as well as overnutrition. So prevention is far better. And also malnourished children are at greater risk of developing NCTs, and not just NCTs, and even grow up to be malnourished adults. This is also another part of malnutrition is anemia across all ages. India has high incidence of any anemia across children less than 5, adolescent, young children, and pregnant lactating women. Coming from children down to adolescent, because we're looking at school-based intervention. So what we are seeing is that there's emergence of overweight and obesity, which is again posing great challenge for us, for the healthcare providers, as well as us as policymakers. Percentage of children less than 5 overweight has increased from 2.1 to 3.4% in the NFHS. So under 5 also has an issue, and adolescent issue, which I have put here also. Thinness on one side remains an issue with adolescent girls as well as boys, 39.7% in girls and 40.8% in boys. As well as on the other side, we have seen an increase in overweight obesity, 5.5% in girls and 6.5% in boys. So we are looking at a dual peak in a country like ours. So our interventions have to be very appropriate and very targeted, so that we are addressing both the issues of malnutrition in our country. So that is happening. On the other hand, we have seen there's a rising sale in ultra processed food. This is as a part of the WHO ICRER 2023 report, which has been compiled by the Euromonitor database, which shows a progressive increase in sale across all. This is not just schools, this is across the whole of the country. If you compare pre and post COVID, this has shown an increase. So this is something for us to worry, because it is ultra processed food, which forms a lot of part of the young children's diet, which we see nowadays. Next, there's increase in edible oil consumption also. So if you look at the graph from the ICR agricultural statistics, which was shared, which is shown a population is increasing and the consumption of oil also has increased in a country as large as ours. Just quickly, I've highlighted in yellow is that since 1950s, per capita consumption has increased by 7 times. Our population has increased by 4 times. The total oil requirement has increased by 24 times. And the recommended oil consumption by ICMR is only 12 kg per capita per year. So we are anyway outpacing ourselves as a country. So the consumption is far more than the production. So we have to have a good relook as to where we are heading. And this is why Honorable Prime Minister, the clarion call given by him becomes really important at this time. During January in the national games in Dehradun, he brought out the call of importance of rapid growth of obesity. Then subsequently, he in his Mann Ki Baat, he talked about the importance of what we need to do to reduce obesity, particularly through lowering the oil consumption. That is where the issue of decreasing by 10%, which already has been mentioned by Subba Rao, but this is really very important. This is 10%, not 10 gram, like he mentioned. So this is something, and the awareness and the ownership of this intervention comes from the highest office, and that gives us a ray of hope that even the highest policymaker is well aware of what the issues which are being faced by the growing children, especially in our country. So what are initiatives? We are looking at a whole of government, a whole of society approach, which is adopted by us to tackle through policy reforms, through community engagement, and through regulatory methods. So all this, whatever intervention I'm going to present to you quickly is to cover these headings. So what are we looking at? First is our school-based intervention, school health and wellness program under Ayushman Bharat, in which we are selecting 2 teachers, training them on themes which are related to health and education. And they are holding regular sessions in schools with children. This is just a couple of photographs. These are interactive sessions. And also they're selecting 2 children per class as health and wellness messengers. So through a change is going to be brought out through schools, in families and in communities. Besides this, we also have adolescent health and wellness days in school, which are targeting issues which are very pertinent to growing children in schools. And just quickly to show that these are the 11 themes which are in school health and wellness program. If you see nutrition, health and sanitation, promotion of healthy lifestyle are 2 very important nutrition targeting thematic areas. If you also look at growing up healthy, also looks at what are the growing issues and how to keep yourself healthy while growing up. So this is the importance which education has given to health of every school going child. These are a couple of guidances which have gone from our ministry, have gone to all the ministries and to the states, is how do you promote healthy lifestyle in school and communities. There is special emphasis on prevention management of obesity, display of oil boards, sugar boards in schools, communities. There have to be key measures for prevention and management through the Ayushman Arogya Mandir, our first line of primary healthcare, which is getting highly strengthened by newer interventions. And especially in this Ayushman Arogya Mandir, there are going to be dedicated days for screening of overweight, obesity, dedicated counseling, talking about lifestyle modification and yoga and follow-up care also. So this is something which is targeting. Besides just targeting the adolescent and school-going children, there is outreach by the adolescent counselors who are going to talk on healthy lifestyle and obesity prevention in schools. And also there will be screening by mobile health teams under RBSK, which we call, which was mentioned by the Karnataka state program officer also, that these are going to be used in tandem. So the counselor will talk about prevention and dealing with issues of overweight, and mobile health teams will be used for screening of children for overweight, obesity, and then appropriate counseling will be done. These are just a couple of photographs which shows that what are the advisories which the ministry has shared with the health ministry has shared with the other ministries and with all the states, whether it is the oil board, the sugar board. And these are all a couple of photographs of children putting oil sugar boards and children participating in yoga activities and exercises in school. So these are going to be something which is incorporated as a routine, as an iterative process within schools, so that every child, whenever they pass the board, whenever they do exercise, it reminds them of how important it is to stay fit. So not just health, we are looking at partnering within health per se, as well as other ministries. So midday meal or the PM portion, which the Karnataka official has already talked about, which is looking at hot cooked meal for children. Eat Right School campaign, the FSSAI is already focusing on healthy and safe foods in schools, promoting awareness. And within that also, they're looking at mandating restrictions on selling of unhealthy food, which has been covered and will be also covered in the coming session, about how important it is for ensuring that unhealthy foods and beverages are not sold within 50 meters of the school environment. I think another partnership with CBSE has come ahead is that they're displaying these boards, which I showed in the last slide, sugar boards and oil boards, as an iterative process. And also, we are also looking at FSSAI as school board, school food regulations, 10-point charter has been, which is covering licensing, hygiene standards, high salt, fat, sugar content restrictions, and of course, canteen compliances. This is something which is a whole of government approach in which every ministry is doing whatever possible to ensure that every school going child is aware and is looked after regarding their nutrition and staying healthy. Coming quickly to what Ministry of Education has done, broadly saying they have also set out advisories to all the states talking about raising awareness through school-based sessions on how 10% bringing down will work wonders for health and nutrition of children. Using of 10% less in cooking of midday meal has been advised, promoting healthier options of cooking like steaming, grilling, and baking instead of all the time deep fat frying. Then it also advocates for daily exercise and yoga, like a sample of photograph which I've shared with you. And also the cooks and helpers are going to be trained on newer techniques which will use lesser oil usage while cooking of the midday meals. And also they will have ensured that nutrition experts, like previous session, colleague Ms. Jairath also mentioned about interventions in schools. So a lot of states are being promoted to invite nutrition experts to discuss how low oil foods, oil diets, and also share healthy recipes so that you have local context as to what is available and can be doable in those states. Okay, next, sorry. Yeah, so now finally, I would like to end by saying as a government, what can we do? First is we have to develop specific food standards which will show what healthy foods are, especially in school-going context. Second is we have to enhance access to nutritious foods in schools so that children can easily access healthy food in school. Third is also to incorporate nutrition education within the whole curriculum of education and also as an extra activity within schools. We have to restrict marketing of unhealthy foods in and around schools. And one very critical thing is involving the school community. School community is not just the school teachers, but also the principals, the school management committees, the parents through the PTM. So if the entire school community is involved in creating of this health awareness within school and for children, this will go a very long way. Establishing supportive facilities. We have to have clean drinking water, safe washroom facilities, and storage facilities for food so that healthy food options are all the time available. Encouraging a caring and respectful atmosphere is very critical, because we have realized under and overnutrition both may have physical as well as mental health issues. So let us have a caring, respectful, stigma-free atmosphere so that every child can access safe and healthy food without fear of any stigma. And finally, we should also assess and review the effectiveness of whatever we are doing in schools. And if it is found to be less than effective, why don't we do the necessary changes so that the intervention, the support which schools are being given can be further improved and further strengthened. And that is from me. Thank you so much. These are just images of school-based programs in which the health and wellness ambassadors are talking about health and nutrition. Thank you so much.
Uh, Thank you, and thank you for that quick outline. In this, in these four talks that we've had, we deliberately put the global perspective and the best practices and the government perspective, and also a research perspective and a state level, micro level perspective. I think that has given a well-rounded approach to the food environments and the grassroots level work that is happening, along with the challenges that are faced. For all the four speakers, if you are available, there are some quick questions that I would like to first take before moving into the panel discussion. One of the questions is, how feasible is the diversification of midday meals at state level? As I understand, uh, I think this is directed at Dr. Suparna, that this is a work done at a block level. When you look at the state, there might be various regional variations, and how do you get the diversity incorporated into it? Can you take this question, Dr. Suparna?
Yeah, sure. Sure. That's why we did the formative phase exercise, and we what realized is that the menu comes from the state, definitely at the central level, like at the top level. But at the district level, there is a possibility to work around with the vegetables and the I think sensitization is key here, and the nutrition literacy should happen at all the levels. Contextualizing the food, making the vegetables more commonly consumed in that particular context is very important. So, if the state level menu, which trickles down to the district and the block level, has this provision of use seasonal vegetables, which is the case, they say green leafy vegetables. What we tried to do is in the Nutri Gardens, we tried to promote the local green leafy vegetables and incorporated those in the menu. So that kind of a confidence should be there at the grassroots level, school teachers level, that these foods can be very well incorporated into the government menu. And that flexibility at the lowest level of tweaking with the vegetables, the fruits, the pulses. Certain things which are coming from the public distribution system, we cannot change it much. Like if rice is coming, rice will come. We cannot immediately change it to millets. But things have happened. In Karnataka, as you can see, millets are introduced. And that is where the local contextualization is happening. So I think nutrition sensitization, if you are talking about at the lowest level, at the community level, the nutrition sensitization should happen from the top to the bottom. And that is where the contextualization and local customization is definitely feasible. So a blanket menu with lots of diversification is feasible at the lowest level. I'll stop here.
Okay, ma'am, and also this is related to government makes many policies, but at the school level, ground level, it is not possible to implement. How to do or follow that? Dr. Zoya, I think you are the best one to take this.
Yes, of course, government makes policies with the vast experience of implementation in all the states. But yes, a lot of it hinges on the partnership which at the national government we have with the Ministry of Education and our training partners NCRT. So it is a tough job. I fully agree it is. But then the co-ownership of both the ministries is something which is going to, I think, push the program of school health and wellness, in which the teachers are trained to talk on health and wellness. So that ownership one has come from teachers, and they are accountable for the, I think, improved behavior, improved knowledge of their school children will go a long way. So since we are still in the beginning of this program, we still haven't reached all the states. I would say time will tell us that how well it has taken. But I'm quite sure with an issue as important as overweight, obesity, and nutrition challenges which the school children are facing, I think we will do better in coming couple of years.
Yeah, one more question to you about private school canteens. What are the policies that are being taken to ensure?
Okay.
Because government schools do not have canteens. Most private schools do have. How do
Yes.
you improve the food environment there?
Only quickly to say that the private schools we have already done is in coordination with NCRT. We have oriented all the principals of about the 28,000 CBSE affiliated private schools. So we have started that whole, I would say, muhim, that mission of also orienting private schools. So one round of orientation of CBSE principals has happened, and we have informed them about bringing about the changes in canteens. So I'm saying any change at the government level takes time, but we have taken the first couple of steps. The coordination is well in way, but how the whole thing will pan out in a couple of years, we'll see. But I think the awareness has really started, and that is a big step for us.
Thank you. That's very interesting. I think in the interest of time, we'll move to the panel discussion. If time permits, at the end, we'll take few more questions before I wrap up and then give 5 key takeaways. To take the next step forward, the panel discussion, I'll request my colleagues Sanjana and Paramita to please introduce all the speakers, all the panelists at one go, and then Ishani will moderate this panel discussion. Over to you, Sanjana and Dr. Paramita.
Yes, sir. I'm pleased to welcome our first panelist for the day, Dr. Kathy Tiwari, nutrition specialist at UNICEF, Hyderabad, India. With over a decade of experience in maternal, child, and adolescent nutrition, Dr. Tiwari is recognized for her systems approach and evidence-based policy advocacy. Ma'am holds a master's in public health from the Tata Institute of Social Sciences, Mumbai, and PhD in public policy. At UNICEF, she leads key initiatives including infant and young child nutrition, community-based management of acute malnutrition, antenatal care, and early childhood development, driving innovations that have positively impacted over 3 million women and children. MAM work extends to fostering multi-sectoral partnerships, developing digital solutions, and contributing to global engagements, including with UNICEF Philippines. I would like to continue introducing our next panelist for the day, Dr. Jaishankar S. Thodkar. We are honored to welcome you today, ma'am. Ma'am is the director of the Indian Institute of Metabolic Sciences and distinguished laparoscopic and bariatric surgeon with over 2 decades of expertise. A pioneer in her field, she is the first female bariatric surgeon from India and the first Indian woman surgeon to demonstrate live surgeries on both national and international platforms. She has been instrumental in establishing the first state obesity and NCD task force in Maharashtra and launched the Fight Childhood Obesity campaign in 2017. A record holder featured in the Limca Book of Records for performing 45 hernia surgeries in 10 hours. Dr. Todkar's innovative thoracoscopic surgery technique for radical thymectomy in myasthenia gravis was selected for inclusion in the Sages Pearl Journal World Reference Library. Her exceptional contributions have been recognized through numerous awards and fellowships.
I would next introduce our third panelist, Dr. Shri Harish Kumar Mirna. He is Associate Professor at NCERT, India. He is the Nodal Officer of Drug and Tobacco Control, leading implementation of Tobacco-Free Educational Institutions Initiative. He is the Program Coordinator of Ayushman Bharat Health and Wellness Program. And with over 18 years of experience, Dr. Meena specializes in content development for children, adolescents, and has trained thousands of national and state level resource persons under the flagship government programs. Next. Next slide. Just a second. Yes, our adolescent panelist, very important for this discussion, is Miss Rishita. She is a student of class 11 at DAV Public School, Sahiabad. She is pursuing medical stream with legal studies and has been an active member of the LFOF initiative. She has been actively contributing to the content creation, youth-led social media campaigns of this initiative. She serves as the official CBSE peer educator ambassador for mental health, overall well-being, and beyond her academics, she is a senior diploma holder in Kathak, a national skating player. Next. Just a second.
It's fine. You can introduce without showing slide.
Okay, there is some technical glitch, but still I'll introduce Miss Vidhi Oberoi. She's the last panelist for this session. She's from Bal Bharati Public School, Noida. Miss Oberoi holds a postgraduate certification in educational leadership from IIT Kharagpur and animal physiology from IIT Kanpur, alongside an MSc in ecology and environment. She has been honored with awards such as the Sarabhai Teacher Scientist National Award and the Global Teacher Award. As, as the Wiki President of our Uttar Pradesh Science and Technology Council, she is committed to advancing the scientific literacy and sustainability. Ms. Oberoi her works include presenting research, publication of educational materials with NCERT and Cambridge University Press. Now I would like to ask my colleague Ishani to begin the panel discussion session.
Good afternoon, I'm Shani. The first question is to Dr. Kati Tiwari. Based on evidence and your field experience, ma'am, what school-based interventions have been most effective in improving the nutrition quality of foods provided or sold in or around schools?
Great. Thank you so much. So I'll start with thanking the organizers first, National Institute of Nutrition and the LFOF initiative. I'm honored to be present here today. I think a lot of this has already been spoken, and something that has come out very, very clearly is that when we are looking at effective school-based interventions, we can't just do one thing or the other. It has to be a multi-pronged approach. It has to be an approach that brings together policy, it brings together environmental changes, create an enabling environment, and behavior change strategies together in order to have all the elements which can bring success in initiatives around promoting healthy and nutritious food for children. Policy environment, as Dr. Zoya has already spoken quite elaborately, is the foundation of a systemic change. It requires, creating standards and expectations for what is required in each and every school. It is there for every child, and this is where we have to start looking at a lens of right to food instead of looking at where we can implement. Children studying in any part of the country, whether it's private school, government aided school, government schools, require that kind of support and that kind of coverage and security through the rights approach that India offers. And that's where the policy becomes more and more important for us to start looking at things which come to children as default and not as an exception. You get something because you're a part of this school. Instead of that approach, we should have a rights-based approach which extends itself to all children across all schools and all environments. We have spoken extensively around the kind of behavior change strategies that are required, but mostly at the center of this continues to remain the children. We are talking about integration of nutrition into curriculum. We're talking about motivating children, orienting children, and creating awareness around what is the kind of food that they should be taking, which is definitely the most important part because these are the primary stakeholders that we have to look at. But at the same time, and I do see that there are a lot of questions around how do we create that kind of parental engagement, because at the end of the day, parents and teachers are the enablers of the kind of food and nutrition that children receive. And hence, there should be an extension of our communication and behavior change strategies to include parents into this gamut as well. We should be talking about creating more platforms where we can bring parents to this platform who can speak. And again, we should be looking at an equity-based approach because parents everywhere cannot be the same. What we have perhaps in Delhi may not be same somewhere in a interior tribal area. So we need to create a platform which is equating and bringing people, children, and parents available together. I think I would also want to highlight, and this again comes from Karnataka, an initiative that is taken as a part of government of Karnataka initiative. They are using a public monitoring app which is called NIPCA, which is where the school management committees and parents together are monitoring the food environment inside the schools, and they are taking action at the community level to make sure that children are getting the best of what is available, and also aligning themselves to what is recommended in the diets and the guidelines that are recommended nationally and by the state. And hence bringing back to the point that what's most important is having multi-component programs which bring synergistic effects, and we have many such examples, but I would like to just cite out one framework that caught my attention when I was reading about it is the CDC's Whole Food, Whole Community, Whole Child framework that brings all the components of healthy school food environment together. And this is something which aligns a lot of things that we have been talking about, but it brings all these aspects together onto one platform. That's where I will stop and pass it back to you, Ishani.
Thank you so much, ma'am. That was a very comprehensive overview of the whole presentations. My next question is to Dr. Jayashree. As a bariatric surgeon and someone who's created public health campaigns, what early stage interventions in schools could prevent obesity in children and adolescents, ma'am?
So I think it is very important for sensitization of the kids from the day of entry in the schools. Okay. So let us not treat the students only as the takers, but they should be treated as ambassadors or messengers for the society. So they take the message home back to their school, parents and the society also. Uh, Number two, giving them, I mean, understanding that yes, it should be a part of curriculum, it should be a part of their health, nutrition. If not followed, what can be the diseases coming up, and how to really not enter into that cycle. This is how it should come from the first standard till the 11th or 12th standard. So, sequentially, first you may tell them about what are good habits, what are bad habits, what are ugly things in the narration which they understand. Then, second can be what is the disease. It can come from the 5th to 8th standard. What are the problems? If they don't look at it, why they should look into it seriously. Okay. And then can be about what can be the really impactful things they should adopt in their own behaviors. This is how it should be a part of health curriculum. The other part which I want to stress on is uh, the healthy habits, eating, and the health science around the nutrition to prevent obesity. It should not become a lecture alone. It should be very attractive, like a game. Fortunately, now we have got AI. Fortunately, now we have got the what do you say, high technical developments, the technology with us. So gaming is something which they are fond of, and I think it should come to them in a very nice manner, can be an attractive and engaging manner. And here I will give the example of Fight Child Obesity documentary which we created. It is just a 7 minutes documentary. I would be very happy to share with the panel here. The documentary talks about all these things in a very pictorial, nice manner. It becomes a picture for them. Picture means movie for them. And this is how they understand the things. One, then we understood that only showing documentary once is not going to be of big use. They should be more positively engaged. So we created a drawing competition around it. So let them see the documentary once, let them think over it, and at the end of the month, let them have their own papers, own pencil or pen or sketch pen, whatever, and then let them come out with their presentation about whatever they have understood out of the documentary. This can become one of the very strong engaging things, and I'm very happy to share with you that we could reach nearly 4 lakh. We could receive, actually we could receive on our cloud nearly 4 lakh drawings which the kids draw in the last 5 years, 2 years of this COVID, we have to omit them. But this is how we could reach those many students. That means those many submitted the drawings. I understand that almost into five people must have received the documentary and given some thought on it. So my first thing will be, we have to use something which is going to be an annual happening. We can make, my suggestion is, we should have 14th of November, which comes to us as a Baldin or maybe a Children's Day, which happens to be also a World Anti-Diabetes Day. And we becoming the diabetes capital of the world, we can use that as one of the very strong days to have this kind of activity which will happen annually, and that should become a part of their school rituals, you can say. This is one part. The other thing which we implemented was something which I'll show you here. This is a BMI dialer. I don't know whether you are able to see or not.
We can see it now.
Yeah, so this is a BMI dialer which we created. If we can put this in the schools or at many public places where you have got the weight and the height and also the zone of BMI that comes. So you put your weight, you put your height, you understand you are in the red zone. You put your weight, you put your height, you understand that yes, you are moving in the green zone, or something like this. This can become a very entertaining, at the same time engaging and interesting thing for them, to give an understanding, yes, where I stand and what should be done to change it. This can be the second thing which we implemented in many places, but I think a mass basis is needed. The third part which I will say is the kind of nutri garden which people talked about. Uh, the experts in the morning talked about the nutri garden, or maybe you can say the school as the food forest kind of thing. I think these are very important things where we can actually not just preach but practically make them work on it. In this sense, not only food and nutrition or the disease should be a part of the training or the curriculum, but agriculture also, if it can come, how to really get the good crop, what is called as good crop, and what all those things. These things are important. So what I understand is, we have to monitor the systems for sure. We have to give them the models for sure, but we have to motivate them. So just from monitoring, we have to move to motivation also, and which can be in a very interesting way to them. So banning policies tend to fail often, because then the human mind wants to go to that place which is banned. And I think there we have to catch them at the, I mean, get them into the right zone. One more thing I want to suggest is what we tried to do in Maharashtra under the obesity task force. We tried to get the calorie on the menu card for the restaurants. So packed food, we have got labels, but we don't have got any labeling or any nutritional facts about the restaurant food or whatever is prepared there. So that is one thing which I want to suggest, and it is possible, calorie on the menu card. The other part is, we can have mobile nutrition scanners which can tell us what is the nutritional status of the food or the tiffin, what you are giving to the kids, what is made in the canteen. So all those things can be, the mobiles can be used with their apps as a good scanner for nutrition, for them to understand it better. And I think that can become one of the fads. People are now attracted to fads, so we have to create some healthy fads in the using the AI and the technology. This
Thank you
is
so
what
much.
I will suggest. Okay.
Yes. In the interest of time, I would love to ask more questions, but if we have some time in the end, maybe we can take some questions then. My next question is directed to Ms. Vidhi Oberoi. What do you think plays a bigger role in shaping young children's eating habits? Is it the home environment? Is it the choice architecture that is in schools?
A very good morning to everyone. First of all, thank you so much for giving me this opportunity. And let me begin by saying that our school students have been engaged with the Let's Fix Our initiative, actively contributing towards promoting healthier food environments. I think the school plays a very big role, but it's one part of a much bigger puzzle. Children spend 6 to 8 hours a day in school, often eating at least one meal or a snack there. So the choices we present in our canteens, the way we model healthy eating during school hours, is even the kind of food used in events or celebrations, all shape their daily habits. That being said, children don't live in a bubble. The influence of home, neighborhoods, and media is equally powerful. At home, parents set the tone for what is considered normal to eat. In neighborhoods, the easy availability of fried and packaged snacks can undo a lot of the progress we make in school. And media, especially social media, markets high sugar, high salt foods in a way that's aspirational and attractive to young minds. Additionally, with food delivery apps making fast food readily available, students can order unhealthy meals with just a few clicks. Furthermore, the cash on delivery option removes parental oversight, increasing the consumption of ultra processed foods high in fat, sugar, and salt. In my work experience, working with the Let's Fix Our Food initiative, where students and teachers of my school were involved in NEAT as tool surveys, which helps assess the nutrition environment in schools, I realized how much the school's role intersects with these other environments. A healthy school food environment can reinforce what children are learning at home and counter some of the unhealthy messages they get outside. Earlier this year, when I had the opportunity to participate in multi-stakeholder meeting at ICMR, where the policy brief and outcome documents were released, it was that we need whole society approach. Thank you so much.
Next question. As a parent, what are the challenges that you faced while encouraging a child to eat healthy foods? Maybe you can just answer in one or two sentences.
Come again, please.
As a parent, what are the challenges that you face while encouraging a child to eat healthy foods? With their influence factor and
Actually, as a parent, the biggest challenge is peer influence. Children often want to eat that what their friends are eating, even if it's less healthy. So, visual and sensory appeal of packaged snacks, which can overshadow the healthy food packed from home, because unhealthy options are easily available and temptation is hard to resist. So even if parents try their best, surrounding food environment plays a huge role in child's choices.
thank you so much, ma'am. And now we'll hear it directly from our adolescent, Ms. Rishita. Rishita, do your friends ever talk about healthy eating and what influences your peer group's choices the most? Like, is it taste, is it price, or is it popularity?
Thank you so much for the question. Firstly, I would start by thanking the National Institute of Nutrition and NFOF for actually choosing me and giving me this opportunity to sit in front of such experts. I'm truly grateful for the same. Well, considering your question, right? So, healthy eating, yeah, most definitely. But in a very casual way, I wouldn't say that we talk about certain serious deliberations because, yeah, we are adolescents after all. But I would say rather, I am the initial point of the discussion because, as being a part of this program, I definitely initiate certain conversations, I would say. And then, furthermore, I would say it's when a sports event is approaching, suppose. So, definitely everyone suddenly turns healthy. And when exams are approaching, everyone starts binge eating. So, definitely the nature changes, and so does the behavior. While for me, to be honest, price definitely comes first, then taste, and then popularity. Because as being the adolescent, we don't always have money on our hands, right? So definitely price is something we really need to consider. Afterwards, the taste is definitely something when we talk about food, there is taste. But I do believe popularity is something which comes with Instagram trends and seeing a cafe online and going there. I would rather say that talking about Instagram trends, there are certain adolescents and my peers also, and me myself getting influenced about certain body images and stuff like that, and actually seeing um, to get fit, not just because to actually be nutritious enough, rather to just look a certain way. And we tend to forget that actually health can comes into different shapes and sizes. And there is one or two more points that I would like to add. It's rather that as being the LFOF ambassador, we have to work upon certain criteria, such as how the food should be visible, affordable, and actually tasty. Because the thing is, it's the need to find the alternatives for the food that we have in our canteen areas. Because the default settings have been so much so that our default choices are rather towards an unhealthier side, because what we see is what we approach. So definitely a big thing is the accessibility of the foods that we are getting in our canteen areas, and definitely in the environment. Because definitely what is in our sight is in our mind, and it's definitely accessible much more, because what we are seeing, okay, it's rather much more portable, we take that, right? And also we need to bifurcate, for an example, that how 100 calories actually look on a plate. 100 calories, as in when we see a chocolate is this much, but when we see in a salad is this much and it has nutrition values. And the thought of actually preparing a salad, carrying a salad, or actually setting up certain booths where we sell roasted makhanas, chanas, and certain healthy alternatives is definitely a tiring change. But I do believe that we all being a part of this change, it takes time, but when we consistent, it will definitely bring out green colors.
Do you think if healthier options, like you said, makhanas, if they were made tastier or more affordable or even accessible in your school canteen, would you and your friends be willing to consume them compared to chips or sugary drinks?
Most definitely, I do believe that this was not something that came sudden to me also. I was also someone who was like, okay, we have to eat something, let's take a snack, right? But my father having a keen interest in nutrition also, and obviously definitely the LFOF and other teachers suddenly being very concerned about the nutrition and other factors, we got to know that the change that we bring into our lives, definitely we need to build a taste. Our taste buds are not definitely in those default settings that will hinder the taste and then go towards the nutrition value. But as the time passes, when once the taste is built, I do believe that we definitely start feeling that the healthier food is the tastier food, because we start feeling clean from inside also, and what's internal definitely comes outwards. And then we start feeling that it also impacts our very much of academic pressure handling. It comes towards our health also, and different certain criteria to think about.
Thank you so much, Rishita. Uh, Harish ji has stepped out briefly for an important meeting, so we have time for a couple more questions. I have one for Dr. Khyati Tiwari. In your experience, ma'am, how important is it to have clear nutrition guidelines and standards for schools in their meals and snacks, and what are the key elements that they should contain?
Thank you for the question, Ishita. I think since morning we've been talking about why it's important to understand what healthy diet means, and I would think that a policy or a guideline goes a long way in establishing what do we mean. So it kind of helps you put up some measurable factors into it, and it also reduces ambiguity as to what is actually healthy for which age group. So that's a absolute essential, I think, in order to uh, make sure that we have visibility of the direction in which we are moving, a robust guideline, a clear guideline establishing um, how we define healthy foods, how we look at implementation of these foods at various levels. So one thing definitely is to look at the nutrition security aspect of it, whether we are able to define through this guideline what are the micros, macros, portions, sizes, age-wise that we do require. And second thing, which I think has been discussed quite a few times again in this webinar, is the accountability part of it. And the guidelines should elaborate alongside what should be given to children and what children should receive, who is accountable for upholding these guidelines and at what level. So if it's school level, who's responsible for it? If it's at household level, who's responsible for it? And if there are regulatory frameworks that we have defined to restrict consumption of certain kind of foods, availability of certain kinds of foods in schools, in canteens, outside the schools and things, who should be accountable for making sure that these guidelines are implemented well. Uh, Guidelines are also important in making sure that behavioral modeling can happen effectively using these guidelines. So how do we normalize the eating patterns? And I would quote Rishita when she was saying that, there are phases, there are times during exams we binge eat because we are stressed, and then there are sports days and other events where people suddenly turn very, very healthy. So how do we look at these behavioral modeling, and how can our guidelines find space to look at these aspects that adolescent girl or boy goes through? Can we have those kind of specifications? So often we are talking only about regionalistic adaptations of the food and nutrition related guidelines. What we all often forget is there needs to be adaptations of many more aspects within these guidelines as well. So this becomes an absolute uh, importance on what the guideline could do. There are some very key elements that a guideline should bring in, and so far we've been talking only about the nutrition based requirement. And with the ICMR guidelines coming in last year, there is a further simplification that has happened in an age group appropriate visualization of what your food plate should look like. Now, that's one thing. What we are still missing out is the portion sizes of it, and which can be very, very confusing for different people and different people of different background. And I think that our guidelines should have a section which highlights on this particular element as well. We should definitely have flexibility to incorporate what comes through. There are states in southern India, Tamil Nadu, Karnataka, and also Telangana who have looked at including coarse grains like millets a couple of days in a week, and it has also been seen that this is quite flexible. So within Karnataka itself, we have many, many variations of midday meals that are served across the various districts, and I think it's a very welcome change, bringing in that kind of local and cultural adoptability. It improves the acceptability of the food that's given or provided at the school level. So that becomes very important. I think one of our speakers also very briefly mentioned that there needs to be a very, very clear guidance on food handling practices at all times, whether we are looking at the storage of raw grains or we are talking about cooking, serving, and other services. And this is one aspect on which training is most definitely required, not just in government schools, but also I think in private schools. And the food safety standards upholding becomes very, very important aspect at this. And this is an aspect which would require a recurrent approach of capacity building over a period of time. Not sure if we are really considering this as a programming element such significantly. And then finally comes the part of finances, which is very less spoken about, because you can be very, very ambitious in designing your guidelines and policies which are in place. But if we do not have adequate allocation of finances to ensure that the components that we are talking about are all funded adequately, uh, sustained implementation of these guidelines become a huge concern. So this is a very important thing. And finally, the aspect of monitoring and regulatory frameworks becomes absolutely important. We find this happening only in a certain spaces, in certain feedback, and in fact in some schools where we were able to do the SNEET assessment, we found that the only quality check that happened was that the teachers or the cooks were asked to consume the food before the children did. And that was the only quality check that most schools were going through. So I think somewhere it's also important to define what are the standards of those quality checks, what are the monitoring parameters, and who are the people responsible to uphold and are accountable to carry forward these elements. So I think, yeah.
Thank you so much, Dr. Khyati. I have one quick question for Dr. Jayashree. Dr. Jayashree, in 2, 3 short sentences, can you just tell us what are your top 3 recommendations for schools to transform their food environments to support healthy children's metabolic health?
So one thing is school canteens should be given some good guidelines. What food they should keep there. That is one part. Second part is periodic attention to the understanding of the kids about the nutrition, health, and the health environment around them. Number three is physical activity. Make it a mandate. Give some certain points for that. The brownie point is going to make the parents also feel good that okay, my child is on the grounds and I should be happy about it. So I think these three will be my recommendations. Okay.
Thank you so much, ma'am. We have Shri Harish Kumar Meenaji with us from NCRT. So we have initiatives like the Fat and Sugar Board to combat obesity in schools now. Are teachers equipped with the knowledge and tools to promote healthy eating in classrooms?
Okay, good afternoon to all of you. So, thank you for giving me this opportunity to represent the NCRT or Ministry of Education view. Already, Ministry from Health, Dr. Jaya and Joya Ali review said about the school health program. So, the major initiative that we are like leading is the implementation of school health and wellness program. So, over around 500 districts we are implementing this program, but not in a saturation mode. So we are trying to our level best to cover all the schools, but it will take time. So under this initiative, we have a dedicated module on nutrition, health, and sanitation. So these under this program, we usually train two teachers in schools and two health and wellness ambassador, basically peer educators. So on different issues, which also include about nutrition. So the module which is on nutrition, health, and sanitation, basically it's basically aimed at the life skill development, including the behavior change. So all these modules are activity-based modules. So students discuss themselves different case studies and different activities that are there in the module. So they will be able to understand about the nutrition, wellness, diet, and their importance in optimal growth. So different parameters of health also like weight, height, malnutrition, overnutrition, all these things. So it gives them an opportunity to develop a positive attitude along with the knowledge also, and they demonstrate healthy practices through different activities also. And the activities under this, the first activities are nutrition need of children. So they will be able to identify different food groups and their importance. And the focus which is not highlighted in means some speakers said that, but under this program we promote the food items or the food groups which are locally available. So we need to means we promote the food items which are locally available at different sources. So because these locally available food items are more closer to their environment. So what is the need there in that particular region of the country? So we promote that also, and the concept of balanced diet. Another activity which is a quiz kind of things. So their students uh, uh, do so many activities and explain about the good maintaining good health and good food hygiene. And also the module covers the national schemes on nutrition and sanitation. So they will be able to understand different schemes going on with the PM Poshan and other schemes that they will going on. So this is all about what we are doing with the teachers. So teachers are trained at different levels, and as of now, our target is at least two teachers in each school, and later on, these teachers also organize orientation programs for other teachers and staff in the school on different issues, so which also include nutrition.
Okay. And so how do you think that we can ensure that this nutrition education that is imparted to the children doesn't remain just theoretical, but they actually practice it?
Actually, all these activities are like this, whatever we have intervention are basically activity based. So students prepare their own menu for breakfast, lunch, and dinner, and also keeping in mind the balanced diet concept. So, what are the minerals, vitamins, and carbohydrates they required in day-to-day life? So they keep those things in mind, and they prepare their own menu chart for one of the weeks like that. So this is the activity which go beyond their theoretical aspect. I know that there are restrictions with the family backgrounds and the availability of foods, but we try to promote the locally available food which have those minerals or vitamins or like that, so which is easily available also at a cheaper cost. So we do these activities in with the students, so they also get a practical experience of those activities related to nutrition.
Right. Thank you so much, sir. Thank you to all the panelists. This was a very enlightening panel discussion. Over to Dr. Subara.
Thank you very much, Ishani, for conducting that panel discussion. Thank you, Harish Kumarji, for that outline. We wanted you in the panel because the NCRT presence and was very, very important, because there are teachers, there are students who are here. Dr. Jayashree herself, being a busy surgeon, has done so much work in public awareness. So we wanted her perspective. Khyati has actually worked on neatest tool in Telangana, and that's the reason why this panel had this diverse panelists, and there is a lot to take home. And I wish we had time to answer some of the questions. One of the questions that is lingering here is about the schools, and then says, do we have any mechanism to evaluate the sugar boards that NCRT has asked people put up, and what is the effect of it? One of the questions in the Q&A box. Harish, do you have any answer to that? Does NCRT want to get back and see what is the impact of this?
Can you repeat, sir?
The sugar boards and the fat boards that have been asked to put up in schools. Is there any idea of evaluating their effect or their impact?
Actually, this initiative means we will definitely do all the evaluation of our initiatives. But since it is a new concept, that ministry also issued guidelines to schools, especially on these issues, and also the reduction of 10% of the cooking oil in the midday meal and other advisory. So we time to time we have a self-evaluation kind of things, and a third-party evaluation also of all the initiatives. So we will include all these concerns and issues also in further in future evaluations.
Yeah, as a research institute, probably we'll also take it up very soon. As
Dr. Suba Rao, may I
yes,
intervene here for this answer? Actually,
yes.
CBSE has asked us to submit reports, detailed reports on these sugar and oil boards, and all have been under a definite timeline. And I believe DIOS and CBSE is doing that evaluation. Thank you
Yeah,
so much.
July 15th was the timeline, and I hope it's good.
Yeah.
Okay. Thank you very much. I wish I had more time to take, but we already, are 50 beyond the scheduled timeline. So, for the five key takeaways and the closing of this particular webinar, I think there are several takeaways. To restrict to five is very, very difficult. But the most important and the striking statement that I got is from Rishita today. She said, "What is in sight will be on our mind." So our food environment exactly reflects this. What is available, what is seen all around in the school or around the school or anywhere the adolescent or the child is, will be on the mind of the children and the adolescents. So it is our responsibility to ensure that what they see is healthy, so that what they opt will also be healthy. So that's the very striking statement and the key takeaway from this entire thing for me. And as you said, there the for the LFOF initiative has been working towards five broader areas, as Dr. Sanjay has clearly said: taxation, uh, trying to get policies related to restriction of unhealthy foods, advertising and marketing to children, and then taxation and others. But most importantly, it is very important to note that India has to deal with this problem in a very complicated environment, as Dr. Bharti said in her opening remarks, that we have two spectrums of malnutrition, undernutrition, as well as the growing problem of overweight and obesity. That's the context in which the food environments have to be worked at. And key questions about reduction of fat, whether it is good or bad, was also is also to be carefully considered. Number two, and most important, is we've seen from examples that Dr. Catherine has presented from Chile and from Brazil. The key takeaway from those presentations was that any measure that is done voluntarily may yield very few outcomes. So it is necessary to have a stricter regulatory measures. Before that, awareness building is most important, and these initiatives should be very comprehensive, that we cover not just what meal is provided in schools, but also what is sold, what is marketed, and how they are educated about these, and what infrastructure is available, and most importantly, what are the services that are required for ensuring choice architecture is better for children within within the schools and in the vicinity of the schools. The third key takeaway is that uh, from both Dr. Suparna's and Dr. Vinuta's presentations, we see that at grassroots level, a lot of things are happening with government schools in terms of midday meals. But the set of problems that we have with the schools that have canteens is different from that do not have canteens. Similarly, the schools that provide midday meals are different from the ones that do not provide. So these have to be very carefully weighed in. So there are no umbrella solutions that are possible. Co-creation and engaging with the community is the solution, as one of the solutions that we'll have to look at, so that community owns these. And the fourth key takeaway comes from Dr. Zoya, who said the importance of specific food standards, nutrition education as a skill, not just as a theory, and involving the school and the community at large, including parents and teachers, is the most important one. And the fifth one from the panel discussion, what I gather is that whole food, whole community, and whole community approach is a must. And most importantly, the evaluation tools like the NEAT S can help not just the researchers but also schools and children to realize what is available around them and what is the school environment. So these five keys are my key takeaways from this particular discussion. If I missed out on anything, I really apologize. And uh, we have well past the time frame that we've kept for ourselves. But thank you very much for all the speakers and all panelists for their time, and then being with us beyond the scheduled timeline. And also, my sincere thanks to my team who have efficiently organized and coordinated all this, especially Dr. Archana and Sanjana, and Paramita and Ishani for collaborating. Of course, I don't want to forget Miss Kriti, who has designed those lovely posters and e-communication material, and of course, rest of my team. And many thanks to our director, Dr. Bharti Kulkarni, for her constant support. And then she's always available for any such initiative, and then takes time out of her busy schedule to answer this. Dr. Sanjay, thank you for your opening remarks. And Dr. Manika Sharma, who's there all through silently today, but she's the force from the RTSL to run this, and Dr. Preetu, and all others in the LFOF initiative, including Dr. Purnima and others, who have helped us put together this very beautiful panel. Thank you very much. And my thanks to our IT team and the National Institute of Nutrition for all the support. And especially, I would like to thank all attendees who have stayed all through this busy schedule. And then this is also available on YouTube. You can always get back and see. Thank you very much. I'm sure a policy or a brief will emerge out of this e-dialogue, and then we will soon share it on the Let's Fix Our Food initiative, among the Let's Fix Our Food initiative partners, as well as on NIN website. Thank you all. Thank you for joining.
Thank,
Namaskar and
thank
Jai
you.
Hind. Thank you.
Thank you so much, sir. Thank you.
Thank you. Thank you.